Hello, my name is Marianne Gernetzke, and I'm an occupational therapist specializing in pediatric and mental health treatment. I am certified as an FASD trainer, having completed a course conducted by the University of Wisconsin-Madison Department of Family Medicine and Community Health. This presentation includes information from two primary sources. First, the FASD Competency-Based Curriculum Development Guide developed by the Centers for Disease Control and Prevention. Second, the Occupational Therapy Practice Framework developed by the American Occupational Therapy Association to summarize the practice of occupational therapy. The goal of this podcast is to educate families and caregivers, as well as medical and allied health providers, about the distinct value of occupational therapy for individuals with fetal alcohol spectrum disorders. This podcast addresses what occupational therapy is and why it may be an important part of the FASD treatment team. This podcast content will include an overview of disabilities that may be experienced by individuals with FASDs, discussion of FASD and adaptive behaviors, the ability to complete daily skills, what human occupation is and how it relates to adaptive behavior, and how occupational therapists may help clients with FASDs work towards independence. Before reviewing disabilities associated with FASD, it's important to acknowledge that each individual with an FASD is unique. And because they're unique, they deserve client-centered treatment that is specific to their specific strengths and weaknesses. The complexity and severity of symptoms or disability in FASD is dependent upon the amount and timing of prenatal alcohol exposure during pregnancy. Deficits resulting from prenatal alcohol exposure will persist across the lifespan. Prenatal alcohol exposure affects the development of all regions of the brain, as well as the development and migration of cells. Alcohol exposure may influence the development of specific body structures, including facial structures, the structure of hands or feet, or developing organ systems. Prenatal alcohol exposure may also be associated with the following: developmental delays, sensory processing problems, specific learning disabilities, memory deficits, slow processing speed, impaired motor functioning, impaired social skills, difficulty with receptive and/or expressive language, poor regulation of emotions and behavior, or impairments in executive function. Executive functioning deficits may vary in severity across persons with FASDs, but they may include a lack of inhibition or impulse control, poor organization and planning skills, difficulty initiating, sequencing, or completing steps of a task, concrete thinking and difficulty understanding the abstract, limited self-monitoring or self-awareness skills, and poor judgment. Due to executive function deficits, individuals with fetal alcohol spectrum disorders may have difficulty developing new skills, generalizing those skills across environments, understanding or recalling instructions, utilizing previously learned information, demonstrating good judgment and safety, demonstrating emotional control, or initiating, executing, and completing tasks. Each of these components of executive function is important to demonstrate an ability to complete everyday tasks. Adaptive behaviors are those behaviors that are needed to function in daily life and complete everyday tasks. A problem that may be experienced by many persons with FASDs across the lifespan is difficulty demonstrating adaptive behaviors. Even in the presence of a normal or high IQ, a person with an FASD may be confused or frustrated by everyday tasks, especially those that are more complex. The measurement of adaptive function is therefore a very important component of the evaluation of individuals with fetal alcohol spectrum disorders. Occupational therapists are skilled in this type of evaluation. Daily life skills and adaptive behaviors are essential components of human occupation, those activities that occupy our time and attention each day. Let's talk about some definitions of occupation. Occupation includes daily life activities in which people engage over time. Occupation is a human activity that occupies one's time and attention. These activities are goal-directed, purposeful, and valued. Occupation can be observed by others, and it brings meaning and purpose to our lives. When we hear the word occupation, most of us think of work, our job or vocation. However, there are many other occupations that fall under human occupation. These may include education, working in the role of a student. For young children, a primary occupation is play, because much of our development occurs through the process of play when we are young. Play continues to be important for adolescents and adults across the lifespan, so leisure pursuits are also important occupations. Occupations may also include social participation, activities that support healthy rest or sleep, and self-care. When we talk about occupation for self-care, we often refer to activities of daily living. These activities involve taking care of one's own body. They may include bathing or showering, toileting and toilet hygiene, dressing, swallowing and eating, being able to feed oneself, functional mobility, personal device care, personal hygiene and grooming, or sexual activity. Another important area of occupation in the area of self-care are the instrumental activities of daily living. These activities support success in daily life within the home and community. These are the activities that individuals with fetal alcohol spectrum disorders often struggle to complete independently because of their difficulty with organizing complex tasks. Instrumental activities of daily living include care of others, care of pets, child rearing or parenting skills, communication management, driving and community mobility, financial management, health management and maintenance, home establishment and management, meal preparation and cleanup, religious and spiritual activities, safety and emergency maintenance, or shopping. So what does an occupational therapist do with occupation? Occupational therapy is defined as the therapeutic use of everyday life activities, occupations, with individuals or groups for the purpose of enhancing or enabling participation in roles, habits, and routines in home, school, workplace, community, and other settings. The occupational therapist then uses everyday life activities as a therapeutic tool and also helps the individual to work towards independence in their ability to achieve success in everyday skills on their own. Who do occupational therapists work with? We work with individuals of all ages across all levels of ability or disability. This might include people who have developmental challenges, persons who have experienced illness or injury, those with mental illness, or individuals experiencing challenges due to aging. Where do occupational therapists work? We work in a wide range of medical settings, schools and university settings, mental health settings, as well as nursing homes and other geriatric settings. Because occupational therapists work in so many settings, we contact individuals with fetal alcohol spectrum disorders throughout the course of their lifespan and can be a resource to them. Occupational therapists address many challenges that can relate to fetal alcohol spectrum disorders. This includes differences in body structures and functions, deficits in motor skills, problems with sensory processing or emotional regulation, issues resulting from developmental delays, mental health issues, cognitive problems, including difficulty with executive functioning, social skills deficits, problems with sleep or rest, environmental barriers to success, and of course, adaptive behavior and independence skills. Occupational therapists also analyze the environment and the context of human occupation to help support individuals in being successful. So we look at their cultural, personal, physical, sensory, emotional, and social environment and work to find ways to adapt the environment to help ensure that they achieve success in their daily tasks. Possible occupational therapist roles with a client who has an FASD may include evaluating skills, adaptive behaviors, and patterns of behavior related to their daily function, identifying components of a task to work on in treatment to promote functional changes, helping to identify and utilize the client's strengths, identify environmental supports needed to help support independence. These environmental supports may be adding structure or routine to their day, providing them with assistive devices, visual prompts, or social and physical cues. Occupational therapists may also provide parent or caregiver training, and we help the client participate in everyday life activities in a meaningful way. We know that intervention can make a difference. Research tells us that early diagnosis, early intervention, and supportive therapies can improve outcomes for individuals with fetal alcohol spectrum disorders. Diagnosis before the age of 6, for example, is shown to be a protective factor for children with fetal alcohol spectrum disorders. Treatment of sensory issues in childhood can reduce meltdowns and behavior problems. Treatment of adaptive function and self-regulation can also help to reduce the incidence of secondary disabilities with FASDs, such as disruption of school, criminal activity, and mental health problems. With support, many adults with FASDs can live relatively independent lives. As members of the medical, educational, and mental health teams, occupational therapists can make meaningful contributions to the lives of individuals with FASDs and their families. For more information about whether occupational therapy would be an appropriate service for an individual that you know, talk to your primary care provider or go to aota.org. Thank you.